talk to Ms. Soheila Rahimi, Discrimination against Azerbaijani women in Iran regarding the right to public health, medical care, social security, and social services. Thank you very much.
Thank you, Mrs. President. Ladies and gentlemen, my topic will be about the discrimination against Azerbaijanis women in Iran regarding the right to public health, medical care, social security, and social services. In Iran, Azerbaijani women face significant discrimination in accessing public health, medical care, and social security and social services, which highlight the broader challenges confronting this minority nation in the country. This discrimination is often compounded by factors such as gender and language barriers. Despite Iran's commitment to international legal frameworks such as the International Convention on the Elimination of All Forms of racial discrimination, Azerbaijani women continue to face systematic obstacles. Moreover, the World Health Organization Constitution and the Committee on Economic, Social, and Cultural Rights emphasize the right to health as a fundamental right, calling for healthcare services to be available, accessible, acceptable, and of high quality for all without any discrimination. But the most important part of this discrimination against the Azerbaijani women in Iran include the following: access to public health and medical care. Azerbaijani women face various barriers in accessing quality public health services. These include language barriers. Many Azerbaijani women speak Azerbaijani Turkish, and medical services are often provided in Persian. This language barrier can hinder effective communication between patients and healthcare providers, leading to misunderstanding and inadequate treatment. This challenge is especially significant in rural areas where bilingualism in Persian and Azerbaijani may be less prevalent. Geographical disparities. Azerbaijani women living in remote areas often face limited access to healthcare facilities. Health resources are more concentrated in urban centers, leaving marginalized communities with limited healthcare services. Rural Azerbaijani women may have to travel long distance to receive specialized care, which creates further difficulty due to financial and social problems. Gender-specific health issues. Azerbaijani women, particularly those in rural communities, may face additional obstacles related to cultural norms and gender exceptions. These norms can limit their ability to seek health care services, particularly for issues related to reproductive health, family planning, and sexual health may be limited in these communities. Social security and social services. Economic disparities. Azerbaijani region in Iran often face higher rates of economic marginalization, which directly affected access to social security and social services. Women in these regions who are often economically dependent on male relatives due to traditional gender rules are particularly vulnerable. The lack of economic security can prevent them from accessing health care, social services, and support in cases of abuse or poverty. This situation is far more miserable in rural areas because on the one hand, women are forced to work hard with men in fields and animal husbandry, and on the other hand, they do not have equal access to work income like men. and they are entering old age without any income, health insurance, or saving. Discrimination in social services. Azerbaijani women may face indirect or institutional discrimination when accessing social services, as these services are often centralized in Persian-speaking areas. Discrimination can take the form of neglect and addressing the specific needs of minority nation women, such as tailored program for maternal care, child care, or unemployment assistance. Social exclusion. Women from minority nation, including Azerbaijani women, are often excluded from decision-making process, both in the public sphere and within their communities. This exclusion makes it more difficult for Azerbaijani women to advocate for better social services or to participate in the shaping of policies that affect their lives. Cultural and legal discrimination. Legal barriers. Azerbaijani women face the same gender-based legal restriction as other women in Iran, such as limited legal autonomy, restriction on dress codes, and reduced right in family and inheritance matters. However, as members of a minority nation, Azerbaijani women face additional obstacles. The judicial and legal system, which operate in Persian, may further marginalize them if they can't fully communicate in their language, particularly in matter of family law, healthcare rights, or accessing justice for gender-based violence. Cultural and social marginalization. The Iranian government has historically promoted Persian culture and language at the expense of minority nation identities. This cultural marginalization reinforces a sense of exclusion for Azerbaijani women who may feel disconnected from public institutions, including healthcare and social services providers. The absence of culturally sensitive services means that the specific needs of Azerbaijani women are often overlooked or disregarded. Human rights concern. Repression of Azerbaijani identity. The Iranian government has been criticized for repressing the cultural and linguistic rights of Azerbaijani people. Activists who advocate for Azerbaijani rights, including the rights of education in the Azerbaijani languages, or improved social services, face harassment, and other forms of repression. Azerbaijani women activists are particularly vulnerable to state repression as they navigate both ethnic and gender-based discrimination in their effort to claim their right. Lack of data. On the other challenge in addressing discrimination is the lack of official data on the situation of minority nation women, including Azerbaijani women in Iran. This lack of transparency makes it difficult to assess the full scope of discrimination in public health, social security, and other services. Journalists who have prepared reports on the situation of women in these provinces of Azerbaijan in terms of forced marriage at the age of less than 13, forced pregnancy, and domestic violence has been censored or forced to remain silent. Conclusion. This discriminates faced by Azerbaijani women in Iran regarding access to public health, medical care, social security, and social service. It is multifaceted and deeply intertwined with their ethnic, linguistic, and gender identity. To address this challenge, reforms are needed to ensure language rights, reduce economic disparities, and promote cultural and gender-sensitive social services. Additionally, there need to be more robust enforcement of anti-discrimination law and policies, and signing international treaties as the Convention on the Elimination of All Forms of Discrimination against Women, that ensure minority women have equal access to healthcare, education, and social protection systems. Thank you so much.
Thank you. Thank you very much.